World No Tobacco Day observed every 31st May was established by the World Health Organization in 1987 to raise awareness about the health risks of tobacco use and to encourage policies that reduce tobacco consumption. In Uganda, the Tobacco Control Act 2015 was enacted to regulate tobacco use, reduce exposure to second-hand smoke, and safeguard public health. The law puts a 50-meter smoke-free zone around public places, as well as a ban on tobacco advertising, promotion and sponsorship, among other provisions aimed at curbing tobacco consumption.
The Tobacco Control Act for Uganda is a comprehensive act. It does not provide for smoking zones in the country. It's a total free smoking area. You are not supposed to smoke in public places. That's why we talk of 50 meters, whether at the airport, whether in the bar, whether in the school, whether in a hospital.
Uganda has commemorated the World No Tobacco Day, with the anti-tobacco advocates saying the implementation of the Tobacco Control Act of 2015 has contributed to a decline in tobacco consumption.
When you consider the national surveys or the survey that has been conducted, we are seeing a gradual reduction in terms of tobacco use across the country, because we estimate prevalence of tobacco use for both smoke and non-smokeless tobacco, and we are seeing a reduction in that.
Center manager at the Center for Tobacco Control in Africa, Dr. Jim Arinitwe, says there is inadequate implementation of the law which undermines efforts to protect the public health.
The public is out, but I think we need more effort to make the public even more aware. We need to properly roll the Tobacco Control Act across the country. The urban areas may be more aware than peripheral areas, so there is every need to roll out the tobacco control law across the country, from the central government into local government and also to other community areas, to make sure that everybody is aware about the Tobacco Control Act.
University students and other non-users of tobacco products are concerned over the health risks associated with the tobacco use.
So far, the past years, I've always been facing challenges of being a passive smoker. Like, you may meet somebody in public and then like you happen to sit next to them and the person is kind of smoking. That inhalation of the smoke they are whatevering from the tobacco, it kind of, you feel that kind of suffocation as though you're not breathing well.
Someone smokes, they're at risk of getting contagious diseases like lung cancer especially, and due to that we shall need a lot of money to cover up their health statuses.
A public health officer, Francis Chimuli, says there is a gap in public awareness and sensitization on Uganda's Tobacco Control Act.
Band and nicotine, currently the companies are making different flavors to entice people to take them. So you get addicted to that tobacco, and yet in the long run you are killing yourself slowly by slowly. Uganda as a country, we are participating through different partners, organizations, to continue to raise awareness on the effects of tobacco use.
Some active tobacco users told UBC they were aware of the Tobacco Control Act, but they did not comply to its provisions, although others said they had no knowledge about the law.
Nawulirako naye simanyi buweliro bwalyo, nenga naliwulirako nga mukaaga. Naye bwe mmala okulya bampulira nga mwetaaga, eba ne bwe nzukuka ku makya nti olunaku nyinza okunywa nga 10.
Okukula jjajja wange nasanga akola ki ng'anywa guno omukka. Kati awo ffene tuyigira ku bipapula okola ki okutumbiza no sawundi. Okutumbiza no sawundi.
Banka nywedde bulungi ku makya nga bwakakya nakanya ku maaso nenkanywamu nenkafuwa bulungi, mpulira nga embeera yange ekoze ki eteredde. So naddala ate nga mba maze okulya emba sinakafunako emmeme ekola ki nti emukamala kunywa kasigala kano.
Anti-tobacco advocates have raised concern over the growing presence of emerging tobacco and nicotine products on the market, which is a threat to public health.
If you see along many of our bars in Kampala, we are still having the shisha problem. People are still smoking shisha in broad daylight, in the evening.
It's what you call vaping, and there is also what you call the water pipes. The shisha commonly, these water pipes, people, so the liquids, and these are very popular, particularly among young people and university students and urban traders, all globally and all over the world, and on the increase. And what makes it even worse is that the tobacco industry adds in flavors of flavonoids. And so they become appealing, strawberry and others, they become appealing to young people. They introduce colors that are very attractive to young people. They introduce flavors, they introduce sweeteners, to the extent that at some point, the tobacco industry has also introduced lozenges, like you get tobacco, put it under the lip or the tongue, to continue releasing tobacco into the body. You feel fine, but you are releasing nicotine into your body.
Advocates call for increased taxation on tobacco products to reduce consumption among Ugandans. Aziz Agabo of the Uganda National Health Users and Consumers Association says higher taxes would make tobacco less affordable and help discourage use.
For the last 2 years, the Uganda Tobacco Taxation Coalition has worked with stakeholders, including the Ministry of Finance, the Parliament, the Ministry of Health, to strengthen the tobacco taxation policy and structure in Uganda. As you are aware, the World Framework Convention for Tobacco Control calls on parties to ensure that their tax structure, their taxes, 75%. That's the excise tax to retail price ratio of the tobacco taxes are 75%, and Uganda is way far below that those guidelines of the framework of Convention for Tobacco Control. Currently, we are at between 29 to 30%, and that is really bad for us.
They are also calling for stricter penalties and stronger enforcement of the law. This year's World No Tobacco is on the theme Unmask the Appeal, Countering Tobacco and Nicotine Addiction. I'm Waiva Njuko for UBC.